A very warm welcome to Pennybourne UK. This is the final session of our three-part series focusing on scars and scar care, created for Pennybourne UK by Kate Oldham and myself, Janie Barrett, both experienced therapists with a keen interest in scar therapy and holistic cancer support. In the first introductory session, Kate and I gave an overview of what scars are, looked at both the physical healing process and dealing with the emotional impact of scars. Then in the second session, Kate looked at physical self-care, how massage and movement can help the healing and general health of a scar. And today's session, the third and final part of the series, is focusing on our emotions, understanding the impact scars have on our emotions, and looking at simple tools to help care for our emotional well-being. In the first session, we went through the variety of ways scars can potentially affect us physically, understanding that in the cancer world, scar tissue is not only the result of surgery, but also radiotherapy, PICC lines, ports, and epidurals. Therefore, not all scarring is visible, but they still follow a physical healing process. As well as all the healing and adjusting our bodies are going through physically with a scar, we also have a lot of rebalancing and adjusting to do at an emotional level. One of the reasons why I wanted to do the ScarWorks training was the huge range of complex emotions I find my cancer massage clients had towards their scars, with some unable to look at or touch their scar. There are many ways of supporting ourselves emotionally. Understanding the impact they have on our emotions helps both with preparation before surgery and with the healing after surgery. In the first session, we touched on the mind-body connection. Today we'll be looking at that at a deeper level with a focus on the impact scars can have on us emotionally, related story behind the scar, our sense of identity, and the perceived perception of others. Being aware of the impact of the various elements of the story behind the scar is a big part of the healing process. This is likely to have many layers. Why you needed the surgery, for example, will most likely involve lots of feelings such as shock, disbelief, extreme worry, then the actual surgery itself and everything related to that, the lead up to it, having to tell family, friends, work, then taking time off work and out of normal life to have an experience that in itself can be incredibly overwhelming. And then when we find ourselves on the other side of the surgery and our bodies are having to deal with all the changes that have taken place, there may be a long physical recovery time and a sense of loss of self that may come with that. Not being able to do things as easily as before, perhaps movement is drastically limited, and the appearance of the scar itself. It may take a while to heal, so it can look quite unsightly for a while. And even when it's healed, it may be that it's very visible or in an area that makes you feel unattractive or at least just not like you. Pain can also have a huge drain on our emotions. When we're living with continued pain, it affects our sleep, which can have a massive knock-on effect to our resilience and our overall sense of well-being. This whole experience can create a sense of overwhelm, a feeling of loss of control, fear, concern related to recovery, to overall healing, and of what may happen next. Feeling safe is something that's incredibly challenged with a cancer diagnosis, and many of our emotions are triggered by whether we feel safe or not. The good news is that there's lots we can do to support ourselves emotionally, helping to support that feeling of safety, allowing ourselves to heal at a profound emotional level. Healing beyond the skin. A huge part of the healing process is beyond the affected skin and subsequent scar tissue. It's about tuning into our emotions, learning what our emotions are saying. When we listen to our emotions, when we start to peel back the layers, we automatically learn more about how we feel about the situation and are able to connect more with ourselves. Each layer takes us closer to learning what our emotions are saying about the experience and closer to finding emotional balance. We can think of emotions as energy in motion. And when we give that energy space, it can move. When we listen to our emotions and bring our awareness to why those emotions are there, our emotions find that space to flow and to move on, helping us to feel lighter, freer, and more in control. By listening to our emotions, learning what they're telling us, then we can start to live in harmony with our emotions, which in turn helps us to live in harmony with our scars. understanding that each and every emotion we feel and experience is part of that healing process. Changing the narrative. Reframing our mindset about the scar can be a huge part of recovery and healing. For example, rather than viewing it as something unsightly or painful, perhaps working at developing a mindset that relates to what an amazing job the scar is doing. It's potentially saved your life by removing something that was causing harm and imbalance to your body. This mindset may feel quite ambitious right now and take a little time while you gently process what's happened and how it's made you feel. This can be achieved in lots of different ways. It's about finding the way that suits you. It could perhaps be talking to friends, having some counselling, joining a support group, or some of the self-care suggestions on the next slide. Self-care. This is an opportunity to really look after yourself, a time to do things that make you feel better. Again, this is about finding the right fit for you. It could be journaling, having some counselling, talking therapies, joining a support group, getting some massage or doing self-massage, or seeing a scar work therapist. It could be meditation, hypnotherapy, or listening to some interesting relative podcasts. All working towards the mindset that scars are not imperfections, they're signs of healing. This is a little taster relaxation session, so grab a blanket, a pillow, and then when you're ready, making yourself really comfortable in your chair or bed, shifting your body around until you find a position that's fully comfortable. Great. Our minds and our body are connected and naturally have an impact on each other. By allowing our minds to be calm and peaceful, this has an effect on our body, giving our bodies the best opportunity to come back to balance and to encourage self-healing. So when you're ready, taking a nice, long, slow breath in through the nose, and when you breathe out, gently closing your eyes. And then give yourself a few moments to just arriving into this space. Separating this time from anything that's come before it and anything that might come after it, just arriving into this moment, your time just to be. Lovely, and now taking another nice, long, slow breath in, hold it for a moment, then slowly exhale, fully feeling any tension, any tightness, anything you may have been holding on to gently melting away as you gradually relax more and more deeply with each and every breath. Lovely, and then just letting your breath find its natural rhythm. Breathing calmly and slowly, letting go of any tension, and allowing your body and your mind to relax deeper and deeper. So calm, so serene. And taking a few moments just to enjoy the natural, easy rhythm of your breath. Nice and slow and deep. And now imagining for a moment that all the space around you is filled with a beautiful golden light. The golden light fully enveloping you. And as you breathe in, the golden light is flowing all around your body. And then gently bringing to mind the area where you've had or going to have surgery. You may want to put a hand on this area or just sensing it in your mind's eye. Holding the awareness of this area in your mind's eye for a few moments. And then guiding the golden light, this pure calming energy, towards the area of surgery. Visualizing it, sensing it flowing directly to that area. Bringing with it all the qualities of balance, of calm, and any other qualities that are important to you as part of your self-healing process. Just being aware of all the cells in that area, enveloped, bathed in this golden light, the area being nourished with every in-breath, rejuvenating at a really deep level. This golden light surrounding the whole area. And just repeating this for a few breaths, guiding the golden light to the area, thinking of that area, responding to the golden light, helping it to soften, to soothe, to heal, to repair. And every out-breath actively taking away anything you no longer need. Lovely, and then just giving yourself a moment to notice how you're feeling in this moment. Just allowing yourself to feel however you're feeling right now. Whatever emotions are present. And giving whatever emotions, thoughts or feelings that are there space. Whatever has space can move, can flow, doesn't stagnate or get caught up in a repetitive cycle. And however you feel right now, just accepting yourself just as you are. Great. And then when you're ready, taking 3 nice, long, slow breaths. In through the nose, out through the mouth. And when you're ready, starting to wriggle your toes and your fingers, gently coming back. Just taking as long as you need. Thank you for joining our 3-part series on scar care. If you'd like to access our on-demand resources, book an online session, or visit our centre in Bristol, do visit our website. Or if you'd like to contact us, do get in touch with our team and client support. Many thanks.